Module Overview. Communication lies at the heart of person-centered dementia care. As dementia progresses, individuals experience cognitive decline, memory lapses, speech disruptions, difficulty understanding language, and challenges with nonverbal cues. Despite these changes, emotional perception often remains intact, making compassionate and effective communication essential. This module explores comprehensive strategies for enhancing verbal and nonverbal communication with individuals at various stages of dementia. It highlights culturally sensitive communication, barrier reduction, validation therapy, redirection, tone and pacing, and how to handle agitation or confusion. It also equips caregivers and professionals with the knowledge to preserve dignity, encourage expression, and de-escalate distress through intentional communication. Learning objectives. By the end of this module, you will be able to understand how dementia affects language, memory, and processing. Use person-centered and empathetic communication techniques. Adapt verbal and nonverbal messages for various stages of dementia. Identify and remove environmental and emotional communication barriers. Apply validation and redirection techniques in conversations. Promote calm, respectful, and clear interactions in challenging moments. Empower individuals with dementia to express themselves safely and meaningfully. Incorporate tone, body language, and silence as communication tools. Use culturally and linguistically appropriate methods of interaction. The impact of dementia on communication. Dementia affects multiple regions of the brain. Communication is disrupted through aphasia, difficulty finding the right words or forming sentences. Anomia, inability to recall names or objects. Paraphasia, using the wrong word or sound. Loss of comprehension of spoken or written language. Decline in attention span and ability to follow conversation. Reduced abstract thinking, making metaphors or jokes confusing. Despite these changes, emotional awareness remains, and patients can often sense tone, mood, and body language even when they cannot process words. Principles of effective dementia communication. A. Be present and attentive. Eliminate background noise. Maintain eye contact at eye level, address the person by name, smile and nod to encourage engagement. B. Speak clearly and simply. Use short, simple sentences. Speak slowly, not loudly. Use a warm, calm tone. Repeat key points when needed. C. Be patient and calm. Allow extra time for processing. Pause after each sentence. Avoid interrupting or correcting. Validate feelings, not logic. Non-verbal communication techniques. Use facial expressions, hand gestures, and touch appropriately. Keep your body relaxed and open. Use pictures, objects, or pointing to reinforce meaning. Avoid sudden movements or facial tension. Maintain consistent routines and visual cues to reduce anxiety. Tailoring communication by stage. Early stage. Encourage independence and participation. Offer choices and ask for opinions. Use memory aids, notes, signs, reminders. Middle stage. Repeat instructions. Break tasks into smaller steps. Use calming physical reassurance, e.g., hand-holding. Late stage. Rely heavily on nonverbal communication. Read emotional cues. Use music, touch, and rhythm as tools. Handling challenging conversations and behaviors. People with dementia may experience confusion, paranoia, hallucinations, or aggression. How you respond can calm or escalate the situation. Recommended techniques. Validation therapy. Affirm the person's feelings even if their facts are incorrect. Redirection. Gently shift attention to a safer topic or task. Distraction. Offer a calming activity, music, snack, photo. Active listening. Show empathy and let them vent emotions safely. Avoid arguing or correcting. This may trigger shame or agitation. Example, if a client says, "I need to go home to my mother," who passed away, say, "Tell me about your mother. She sounds special." Don't say, "Your mother is dead, remember?" Cultural and linguistic considerations. Language and communication styles differ globally. Consider preferred names, greetings, and pronouns. Cultural norms for touch, eye contact, and silence. Use of native language when possible. Involving family to interpret or reinforce trust, recognizing religious references or stories that bring comfort. Environmental factors affecting communication. Ensure adequate lighting and reduce shadows. Minimize background noise. TV, alarms, crowded spaces. Remove distractions during meals or activities. Display clocks, calendars, and signs with large fonts. Use visual schedules or cue cards for routines. Empowering expression and engagement. Help individuals express their needs even when words fail. Use music therapy to evoke emotion and memory. Offer photo albums or personal objects. Provide drawing, painting, or simple craft supplies. Encourage spiritual or religious rituals. Acknowledge every attempt at communication. Smile, nod, say thank you. Staff and family communication training. Train all team members and families on daily communication do's and don'ts, signs of agitation and how to respond, de-escalation strategies, inclusive, trauma-informed communication, documenting preferred phrases or memory triggers.